The House of Representatives say it is committed in making efforts to address the challenges in the nation's healthcare system. But stakeholders stress the need for inclusive consultations to ensure lasting solutions. This resolution came up at a public hearing chaired by Honorable Basi Akiba, focused on 4 bills, including amendments to the National Residency Training Act and the National Health Issuance Authority Act, as well as the establishment of the Institute of Healthcare Service Administrators of Nigeria. The Speaker of the House of Representatives, Honorable Tajudeen Abbas, said the health sector has sadly over the years faced several challenges associated with outbound medical tourism, immigration of skilled healthcare workers, poor salaries, and insufficient budgetary allocation. Hence the need for urgent reforms to improve life expectancy and reduce infant mortality. The Speaker was ably represented by the member representing Obia Federal Constituency in Bayelsa State, Honorable Obodo Mitema.
We all know the significance of having a health sector that works. Western countries have taken bold steps to make their health sector first class and second to none. And we must do the same. Though the federal government appropriates a considerable amount yearly to the health sector, the amount is still grossly inadequate and far below what is invested in other countries. It is no longer news that despite the committed efforts, the health sector has sadly over the years faced several challenges associated with urban medical tourism, immigration of skilled healthcare workers, poor salaries, and insufficient budgetary allocation.
Chairman of the committee said the Parliament will ensure legislation that will shape the future of the healthcare and resolve challenges like rising costs and insufficient insurance coverage.
The need for an improved mental health system, increased demand for personalized care, a well-regulated healthcare system. Even though in recent time, government has improved funding for healthcare from the federal government, which is still inadequate. It is imperative to know that besides improved funding enhancement of health information system, regulation of the entire healthcare system, population and health facility surveillance are equally very important. As parliamentarians, it is our responsibility to discuss critical legislation that will not only shape the future of our nation's health, but impact positively on our people.
Stakeholders raised concerns over some bills, including the Nigerian Medical Association's objection to amendments in the Residency Training Act.
The only thing that will help us to have our demographic stratification of the citizens of Nigeria is to have a strong, all-inclusive, comprehensive national social security register. It can only attain this level if it has a legislative backing and if it is allotted a responsibility that is day-to-day.
This bill is very, very important to us as a tertiary health institution and by extension other health institutions, because we are faced daily with situations where we have patients who come to the hospital, among those who even come, because some are even afraid to come because they don't have the money to come. But there are few among these who come around that we are not even talking about them paying their bill. We have to go and be sourcing for food to feed them. And then sometimes when they are going, you are the one to go and even look for transport money to take them home. And these are real situations on a daily basis. And I think the sooner we're able to identify this social group of people, the vulnerable group of people, and get them on this insurance, the better for all of us.
Tobacco industry in Nigeria is a legal industry. Tobacco as a product is a legal product. We are not against regulation of the industry as is done in other climes. But what we are saying is that we need to pay attention to the heavy and huge investments that our members and companies have made, including backward integration, inspired by the policies of government, also developing skills of our people.
In one of its sections, it mentioned that it introduces new distance perimeters for smoking around areas where you have children. It introduces a 30 meters distance for smoking, at areas where you have childcare or parks. We think that this distance is at variance with an existing resolution already passed by the Nigerian Senate in 2018. In 2018, Senator Oluremi Tinubu through Senator Oluremi Tinubu, a resolution was passed for 100 meters distance for tobacco sales and even smoking.
Social register that will help involve the vulnerable people in this country, and it's very good that they're thinking that way too. Some people have low access to healthcare in this country, especially the rural community. So if there's a national social register for them, it will be very important that there's a particular budget in healthcare for them as vulnerable people in this country. And I believe having this bill in the third reading should fly quickly and have people that are more populated in rural communities get access to healthcare. It will help us too. The other bill we had today was the amendment on the national Nigerian residency bill that we think is very, very. It didn't carry the stakeholders along. It was a bill that was passionately written by NAD in 2018. That there's a lot of work done on it. A lot of tenacious work done on it, and we believe that it'll be important for the members of House of Rep to come to those that matter on the bill, those that are important in the bill, those that need the bill, to strengthen it, to make it very validated.
The public hearing brought together stakeholders like the Nigerian Medical Association of Resident Doctors, medical and dental consultants, and chief medical directors. Annie T. Patrick, Core TV News, Abuja.